My name is Kristen Sawalski. I'm the Director of Clinical Science and Consulting for the Wearables and Digital Biomarkers product line in ERT. For today's discussion, we're going to focus on three key elements in this new clinical research landscape. Increased adoption of digital technology combined with greater study activities taking place away from the site changes the roles of sites and patients and increases the importance of connected devices and integrated technologies that support quality endpoint data capture. So now patients are responsible for data capture and quality, giving them much greater influence over study success. So how can you ensure quality, valuable, and compliant data collection from the patient's home or other non-clinic settings? Well, the answer is to support the patient with technology that's built to preserve data quality. So today I'll be covering precision motion wearable technology, specifically ERT's Opal V2C system with remote patient assessment capabilities. So wearable sensors are an inherently natural fit for remote data collection. They are portable, they're lightweight, they're unobtrusive, and they're naturally easy to use. Each inertial sensor contains an accelerometer, magnetometer, and a gyroscope, which collects raw inertial data. This data is processed through advanced algorithms that lie within our software that are specifically designed for precision motion analysis. Objective, validated, and sensitive, as well as reliable endpoints are produced. And perhaps most importantly, they're meaningful to patients as they relate to their quality of life. So instrumented movement tests are historically performed in a clinic. As we see here, we have the hardware typically set up on a desktop or a cart, a rolling cart. You've got the laptop with the software on it so that the site administrator can read the instructions to the patient while they're performing the test. The patient is wearing the sensors, which transmit data wirelessly to the computer via the access point. So how do we enable performing these types of tests in the home? Well, we have several advancements in our technology that enable us to do so. One is the Opal Data Hub. This was designed to retrieve data directly out of the remote location, most commonly the patient's home. So there's no having to go back into the home to retrieve the hardware to obtain the data. The Opal Data Hub is designed to live within the patient's home for the duration of the study. Additionally, we have virtual visit applications that have been developed to enable the site administrator to communicate with a patient and observe them during the tests, as well as advanced software platforms to enable the site administrator to run the test while in a remote location and instruct the patient. Then the third component are cloud-based clinical trial management systems that have been advanced for secure management of data from worldwide locations from multi-site clinical trials. So what types of instrumented movement tests can be performed within the home? We have several that are across three core domains: gait, balance, and mobility. Some classic gait tests include our 2-minute walk test to assess a steady state gait, an open-ended walk, so you can either have a shorter duration walk test or a longer duration walk test, depending upon the needs of the study. Gait initiation tests. So that's that transition period when a patient goes from standing to walking. They have to shift their weight in order to pick up their foot and take that first step. So important information can be found there, as well as turning. There's quite a bit of information that can be found in turns in many populations. Some considerations when moving gait tests from in the clinic to in the home. In the clinic, we typically have longer walkways available. We do recommend 7 meters as a minimum walkway length for the best data. However, we understand that this is not always going to be possible while in the home. So it's important to assess the space available in each patient's home and advise that to use the longest walkway, straight pathway available within their home. Now, it may not be that 7-meter walkway length, but what's important here is to have consistency from each visit. So if it's a 5-meter walkway, they just need to use that same walkway each time. Now, balance tests require less space, so they're easier to perform at the home. So there are subtypes of balance tests, including eyes open or eyes closed, feet apart or feet together, firm surface, foam surface, as well as tandem or single leg. So while these are fairly easy to perform in the home, safety may be a concern. And so if there's not a test assistant available, we would advise things like using a very sturdy chair placed in front to be able to grab onto in case there's a balance issue and if they're going to fall, or having something like a countertop that's sturdy nearby. And then other tests of mobility, such as the classic timed up and go, where the patient is seated in a chair, they rise out of the chair, walk 3 meters, turn, walk 3 meters back, and sit back down. The majority of homes will have this type of space, so this one's fairly easy to perform in the home. And then like sit to stand, another classic mobility measure, really for the lower body. Just rising and sitting back down in a chair 5 times. And then a 360-degree turn or a combined stand and walk test. So what does this look like? What does the setup look like for this remote patient assessment? Well, on the right side of the screen, you see the test administrator who is likely at the site or potentially in their own remote location, right? They have a clinic laptop that contains the advanced software to instruct the patients through the movement test consistently each time. Additionally, if you see an open window next to those instructions, you'll see that the site administrator is able to view the patient in their home or in their remote location through a virtual visit application. So on the left side of the screen, you see the patient in the remote location, most likely their home. They're equipped with sensors, anywhere from 1 to 6. It depends on the endpoints that are most relevant to the study. You see the Opal Data Hub, which the sensors are placed in for in-between use and then removed from the Data Hub and placed on the subject for the instrumented tests. And then you'll see a stand that holds either a tablet or the handheld device. That's the other end of the virtual visit platform. So the subject can see the site administrator and communicate with them, and the site administrator can instruct them and observe them while they're performing the movement tests. After the test sequence is completed, the patient's instructed to remove the sensors and place them back in the Opal Data Hub, and then the data will be retrieved from the home directly into the clinic through a cellular internet mechanism. All right. Hi, Matt.
Hi, Kristen.
Are you ready for your second remote active assessment visit?
Yes, I am.
Great. Okay. Well, I'm just going to kind of explain what I have here on my screen quickly. On the right side of my screen, I have the mobility web application, which enables me to run Matt through some of our instrumented tests. And then on the left side of the screen, I've already connected with Matt with our virtual visit application to be able to instruct him as well as visualize him while he's performing the test to ensure that he performs the test correctly. So I've got Matt's subject ID pulled up here is 002. So I'm going to go ahead and select the test sequence that we want. And so right here we have a remote active assessment demo. So I'll go ahead and add that. And you'll see on the right-hand side that we have a sway test, simple test with feet together and eyes open on a firm surface. That's 30 seconds, followed by a 5 times sit to stand test. So I will hit next. And then this is the screen that I will instruct Matt to place the sensors on properly. So we have 2 sensors being utilized today, the sternum sensor and the lumbar sensor. So if there's any question on how to place these, you can click this hyperlink here and read the instructions. So for the sternum sensor, Matt, I'll have you take both out of the dock. Yep, thank you. Mm-hmm. So what we're looking for here is the synchronization of the sensors. And what indicates this is that the 2 blinking lights are blinking together, and that's what we're waiting for. So this can take up to a minute, but we're already there. So we'll go ahead and have Matt place the sternum sensor on. So you just put that on like you would a shirt. Arms through the hoops.
Very complicated shirt.
Arms through the hoops, and then place the back strap over the head so that the sternum sensor is centered on the flat surface of the chest just below where the collarbone meets. Yep. Looks good. So then we'll go ahead and have you put the lumbar sensor on. You'll place that on your lower back and the clasp will attach in the front. Perfect. All right, so we're set with that sensor placement. I'm gonna go ahead and hit close. And then next, which brings us to the instruction screen to our first test, which is the sway test. So Matt, I'm gonna have you go ahead and stand up and align your toes with the tape on the floor. This was pre-set up. And place your feet together so that they are touching. I'll have you stand upright with straight legs with your hands on your hips. So go ahead and put your, yep. And then for the test, please look forward and remain still without talking or moving for the entire 30-second test. The first tone will indicate the start of the test. I'll also say start. The second tone will indicate the completion of the test, and I'll also let you know verbally when that happens. Are you ready?
I am.
All right, so we're going to begin in 3, 2, 1, and the test is beginning. So in this box, if something odd happened, I could put notes in the trial notes field, but we're fine here. Nothing abnormal happened. So I'll just have Matt go ahead and take a seat and hit continue on to the next test, and that which is the 5 times sit to stand. So Matt, please sit with your back against the chair. Go ahead and place your arms across your chest. Put both feet flat on the floor with your heels directly beneath your knees. And when you hear the first tone, I'm going to have you stand up straight as quickly as you can, then sit back down, keeping your arms folded across your chest if possible. You're going to repeat arising from the chair and sitting back down for a total of 5 times. And the second tone indicates the completion of the test. Again, I'll also inform you to stop. Do you understand, and are you ready?
I am.
All
Yes.
right. So we'll begin in 3, 2, 1, and begin. All right, great, and you can stop. All right, again, you can add in trial notes if needed here, but there was nothing abnormal that happened, so we'll go ahead and hit continue. Oh, and we,
What
we
happened?
have a friend has joined us. All right, so now I'll ask Matt to go ahead and remove the sensors and replace them into the Opal Data Hub and securely dock them. So we're looking for a solid light to appear as you see with that first one. This ensures the proper connectivity with the Opal and the Data Hub. And the same thing for that sternum sensor, okay? So once those are docked, I can open up this tab here, which is the virtual trial upload status tab. Okay, and you see here that there are 2 expected files, 1 from each Opal. Okay, so we can refresh this status, and you can see that data has been uploaded here within this 4th column. So to retrieve the data, this can take up to 24 hours, but it is often done much more quickly, as you can see right here. This is happening live. So I'm going to refresh the status again, and it's complete. So I can go back to the subject tab, pick the subject ID of Matt that we just have here, and check the data. So we have this sway test, right? So if you scroll down, this is the normative data values, and these are mass values that we just collected within the home, right? So this data was collected on the Opal sensors. Once redocked, this was transmitted to me at the site, and I could see the data very quickly. All right, and then for the second test, we can check that that data is there as well. Same thing, we have normative data values, and then there's MATS values right there. Okay, all right, so that's it. That concludes our remote active assessment visit, and thank you. So what kinds of digital endpoints can be retrieved from the home? We see that a wide range of tests can be performed. So what are the outcome measures or the digital endpoints that are available from these tests? Well, we see measures of lower extremity gait, including gait speed, but other factors that can contribute to that, right? The stride length and the cadence. What happens to the foot as it passes through each step? Foot clearance, step time, and variability of these measures, as well as asymmetry of these measures. In addition to the lower extremity measures of gait, we have upper extremity measures, including arm swing range of motion and velocity, asymmetry and variability measures of those as well, and trunk range of motion and lower back or lumbar range of motion during gait. Other measures are turning, and then back to that timed up and go test or a classic sit to stand test, we have postural transition measures, as well as the anticipatory postural adjustment measures that come from that gait initiation task of going from standing to walking. And then, of course, our postural sway measures, most classically the sway area, path length, and sway jerk. All of these measures are objective, validated, sensitive, and reliable. They can be used to track disease progression, as well as evaluate the therapeutic safety and efficacy of different treatments.